Hi, I'm Anushka Chaudhry. Today I'm going to be talking about breast pain. Now, breast pain is one of the most common things that we see in a breast clinic. When I see a patient, they always seem extremely concerned that they may have a cancer. But the truth is that pain is rarely associated with breast cancer. The first thing I'm trying to figure out is the pain truly coming from the breast, or is it coming from somewhere else, what we call referred pain? Now, breast pain itself can be broken into two things: cyclical and non-cyclical pain. Cyclical pain is the kind of pain that's associated with periods. So what women will find is that in a week or so before their period is due, their breasts can become increasingly tender, quite heavy and swollen feeling, and in the lead up to their period this may peak, and then as their period goes away, so does the pain. This pain is nothing to worry about and is due to the sensitivity of the tissue associated with the hormone levels varying. What can be really helpful and reassuring in these situations is keeping something called a pain diary. It's like a calendar where each month one can tick along the dates to see where the pain is the worst, and by looking at the severity you might see a pattern emerging over a few months, and this will give an idea that this pain is indeed related to the menstrual cycle and nothing to worry about. Non-cyclical pain, of course, isn't related to the menstrual cycle. Now, this can be a bit more difficult, and people seem to get more worried about it because it often happens in one breast and not both. Now, I always look at breasts as, although there are two of them, they behave very independently of each other. So think of them like sisters but not twins. With non-cyclical pain, there could be very many causes of it. For example, previous breast surgery, fibrocystic disease of the breasts, age-related changes that are very normal indeed, and some medications can even cause breast sensitivity, for example, starting a new pill, HRT, and even some antidepressant medications. Now, this pain can be very focal. You could even put a thumbprint on the exact area, but the breast tissue itself feels normal underneath. This pain can also be accompanied by a dull, dragging sensation or shooting pains that go from the armpit to the nipple. In the context of a normal examination and sometimes imaging if it's required, this is all very normal, reassuring, and the pain tends to go away itself over some time. So that's cyclical and non-cyclical pain. But what about other causes? So I try to think of these as chest pain kind of causes. For example, muscular pain. Now, if somebody's had a recent chest infection or they've tried a new workout in the gym, then the muscles surrounding the breast on the chest wall area can be quite tender. And because they have a very similar nerve supply to the nerves to the breast, that can cause pain that feels like it's coming from the breast. That's called referred pain. So when I examine a patient, I'm trying to see if the muscles around the breast are in fact tender to let me know, am I worried about the breast at all? Another kind of pain that can come from is angina, so it's important to make sure that there isn't a heart history going on. Then there's something called Tietze syndrome or costochondritis. Now, where the ribs are attached to the breastbone, there is an area of cartilage in all of us. And from sensitivity or inflammation of that cartilage, this can cause extreme feeling of pain in the breasts. So by pressing along the chest wall, it gives me an idea of if I think this might be going on. This is often seen in younger women and also associated with anxiety sometimes. And the way to deal with this is to treat with anti-inflammatory medication, if allowed, for about 6 to 8 weeks, and the pain usually tends to go away. Now, what can we do about breast pain? So I look at this as lifestyle factors and then medication factors. So from a lifestyle point of view, one of the most common causes of breast pain is a poorly fitting bra. So I would say that everyone should get a well-fitting bra, go for a bra fitting. Sometimes when the pain is quite bad, it might help to wear a soft supporting bra even at night time for a period of time. From a dietary point of view, it's important to think about reducing caffeine and alcohol intake. They also think that pain may be related to an imbalance of fatty acids in the diet, and that's why evening primrose oil or starflower oil can be suggested. Now, in large studies, these aren't necessarily proven to be very beneficial, but some women swear by it. But if taken, they need to be taken for about 4 months minimum to know if they're really going to have an effect. Now, stress is a really common cause of breast pain. So it's important to first acknowledge that the pain is real. It's not just in your head, because the sensitivity of the breasts can be increased when the stress hormone levels are up as well. So it's important to consider ways of trying to deal with that stress, yoga, mindfulness, and just taking time for yourself. When we think about the medical treatments of breast pain, a really useful tool is topical painkillers. So ibuprofen or Voltarol gel. Now, this can be really helpful in trying to deal with pain. Now, we don't like taking tablets for pain usually, but by using a topical gel, it also gives the opportunity to have a feel of the breast tissue underneath and kind of reassure yourself that there isn't anything worrying going on under there if it feels normal to you. This is a very good tool and is recommended in many studies. From other medication point of view, if your GP refers you into the breast clinic because the other methods that you've tried haven't worked, we rarely turn to certain types of medications. The reason we don't often turn to adding any other types of medications in is because they don't come with very desirable side effects, and they can only be really given for a short period of time. So the take-home messages are: pain is rarely associated with breast cancer. If you have pain, however, don't panic. Know what's normal for you, and if you're not sure, go and see your GP. I hope that's been helpful for you. Thanks.